Hi, this is Dr. Kelly, and we're going to talk about the big picture around about the amazing job that our bugs have to do and why we really need to start paying attention to them. So there's a myriad of things that they accomplish. They actually detoxify and neutralize agents that are deemed to be dangerous to us and cause disease and inflammation. They are critical in neurotransmission. What do I mean by that? Oddly, you'll find that they make up to 70 to 80% of our neurotransmitters, those chemicals that allow our brain cells to talk to one another. They make something called brain-derived neurotropic factor, which actually makes new neurons in your brain. They make these neurotransmitters that include GABA. You may have heard of that, gamma-aminobutyric acid. They make serotonin, and glutamate, all critical for our ability to retain information, learn information, and make sure our memory is working as well as we would like. Obviously, it has everything to do with our colon health, how well we're digesting, how well we're absorbing, how well we are passing things on through to the end point, or actually collecting the nutrition that we want to absorb. It has an amazing amount to do with our mental health. You'll find out the relationship with our anxiety and depression and Alzheimer's in just a few minutes. With regard to inflammation and pain, I cannot underscore the importance of this piece of it. Now, we do want short-term inflammation. We want to be able to win a war. But when the war is over and the virus is gone, the antigen is gone, the pathogen has been killed, we want the inflammation to stop. But when we have elevated blood sugars, that stirs up inflammation and often will cause a chronic state of inflammation which influences the gut. And when that happens, your gut becomes leaky. We're going to discuss that later on in one of the modules. I will also mention that when there's a lot of sugar in the system, there's something that happens that's called glycation, where the glucose hooks up with the protein or a fat molecule and causes all kinds of havoc and causes tangling of cells and membranes and ultimately changes and alters the normal arterial structure, so you ultimately get less blood flow, which is certainly a problem in the brain, as you'll see when we discuss Alzheimer's. The other thing the gut does, it actually is responsible for assisting in actually making many of the vitamins. They may not be the whole reason the vitamin is produced, but they're critical in parts of the stage of development. B12 is actually one vitamin that is made by the bugs themselves. And as I mentioned, nutrient absorption is key. Interestingly enough, the bugs also have something to do with our balance of two hormones, ghrelin and leptin, that help you discern when you've had enough to eat or when you are still hungry. So you can see just how important the role the bugs play. So what's the translation? If you had a problem in any of those activities that I just stated, you may be somebody experiencing allergy or asthma, which happen when the immune system is overloaded, and the immune system is controlled in large part by our bug population. You may be experiencing attention deficit hyperactivity disorder from poor gut health. Cancer, we know, is often the end result of long-standing unmitigated inflammation as a result of a poor population of good bugs in our gut, as well as increased sugar. We recognize that diabetes can be a sequelae of this problem if we're having absorption challenges and ongoing inflammation. You'll see a little bit more about dementia and Alzheimer's, how that's very much connected with our gut health. Obviously, slow metabolism and lethargy are key components if you're not absorbing nutrients properly, mood alteration, and as I mentioned, poor immune system. I cannot again underscore how important the bugs are to making sure our immune system is not going crazy and it's working properly. You may be experiencing bad breath and gum disease despite the fact you work hard to brush your teeth and floss because of what's happening in the gut. And you may be that individual who's got that ongoing persistent weight challenge and they just can't seem to release it. And it makes you mad and frustrated. And that's exactly why hopefully you're listening to this webinar. But here's the good news. The number one influencer by all stretches of your gut health is your diet. So you ultimately do have control, and we're going to talk about that next. There is a short quiz, and you can either print out the PDF that's on the website, or you can just calculate your answers as we go along. If you're at risk for gut health, you will be saying yes to these questions far more than you will be saying no. So if your mom took antibiotics while you were pregnant, that changes your gut flora, your good bugs versus your bad bugs. If you were born C-section, you were not exposed to your mother's microbiome, her collection of good bugs, as you were passing through the vaginal vault. If you suffered from a lot of ear or throat infections, likely you were given antibiotics. The anti part is the piece you want to focus on because they do devastate your bug population. Have you had your tonsils removed? Now remember, tonsils are one of the organs that collects bad bugs before they get into your system. And if your tonsils were removed, likely they were overwrought with stress. Did your mom take steroids while she was pregnant? That can influence her microbiome as well as yours. Were you breastfed for less than a month or not at all? We know that breastfed babies have a much healthier microbiome. Did you require ear tubes as a child? Obviously, if that's the case, you had several courses of antibiotics. Do you yourself use steroids or have used them for more than a week, including inhalers? So the question is, so far, how are you doing? Do you take antibiotics at least once every 2 to 3 years? The average American does that, actually a little bit more than that. Are you gluten sensitive? You'll see how gluten ties into the gut in a moment. Are you sensitive to chemicals and find that you react to lots of things in your environment when others don't? That tells us your immune system is challenged, hence your gut flora is challenged as well. Do you have type 2 diabetes, suggestive of sugar management challenges, inflammation, and assault to your bug population? Are you taking acid-blocking drugs so you can digest without pain, or you have reflux? That also suggests that your gut microbiome is altered. Do you have food allergies? Again, suggesting you have an immune system override. Have you been diagnosed with autoimmune disease? Rheumatoid arthritis, things of that nature, again indicating immune system challenge. And are you traditionally 20 pounds overweight? You may be in that population where the bug flora plays a particular role as to why that is happening. And lastly, do you suffer from any irritable bowel syndrome, diverticulitis, diverticulosis, Crohn's disease? Do you rely on laxatives to get you going? Or do you have diarrhea or loose bowels on somewhat of a regular basis? And do you suffer from depression? So if you had answered more than one or two of these questions, yes, likely there's a problem in your gut flora. And I will also tell you, if you said, I'm stellar here, likely you can still improve your gut flora. So let's go on to Module 3, where we will start to understand a little bit more about why these bugs are so powerful, because I believe if you really understand this topic, you'll be much more motivated to make the changes that you need. So thank you. Look forward to speaking to you.